I've been talking with a lot of people. I guess everybody's been talking about when can we reopen this economy, and when I've talked to people about how do you think it's going to affect disadvantaged Americans, some people say, well, it'll be best for them initially because they're the ones who are going to get their jobs back most quickly. Of course, they'll also be on the front line should there be reinfections. How do you think reopening will affect more disadvantaged Americans, and will it increase or decrease the inequities that we're seeing in that sense?
Well, in some ways, San Francisco is the epicenter of inequities. We're a very wealthy community generally, but we definitely have people among us who really suffer because they don't have places to live, they don't have enough money, they don't have enough food, and that is only highlighted by the pandemic, as we've been discussing here. Um, when I think of the way that we're likely to reopen in this community, in this state, I think of it as less like a switch and more like a dial. And the only way we're going to continue to do well and continue to have a flat curve locally and in this state is if we're very careful and very precise about the way we reopen. Unfortunately, by protecting the public health, it means that the economy continues to be constrained to some degree. And I'm not sure how a careful reopening of the economy benefits poorer people more than it benefits wealthy people. It would be nice if that were the case, but I'm not sure. So I think we continue to need to be focused on the needs of our more vulnerable citizens because they're going to have more needs than others.
Yeah, yeah. John, do you have a different sense or the same sense about how reopening would differentially affect more disadvantaged Americans?
Well, I agree with the last comment, because if we do not have adequate testing and we're saying people, you can go back to work now, and they haven't been tested, they could be carriers or they could be susceptible to picking up the disease first. And so if we're sending the folks who are in the hospitality industry, the cooks, the waiters, bartenders back, before we know that they're safe, that's where everyone is concerned about the second wave. So I think it is a cause for concern. And as Elaine pointed out, they're just getting enough tests to do their own employees, and to do a community-wide testing. We're so far away from that right now that, again, I think the folks at the lower end will be the most susceptible to reinfection if we go forward without that in place.